Well, principally we visit the GP twice a year for renewal of scripts. Daniel takes a number of medications. He takes 3 different medications for epilepsy, Zoloft for depression, and Ritalin for concentration. So we need to get most of those scripts renewed at the GP and the Ritalin at the psychiatrist. The GP's involved with really coordinating all of the health experts, so the neurologist, the psychiatrist, occupational speech therapists. So we do see him every 6 months and on occasions for other health issues, but he's extraordinarily healthy, so generally we don't have other issues. Probably the only recurring issue is that he's obsessive-compulsive about picking his hands and feet and pulls the skin off, and that gets an infection, so sometimes we have to follow up from that. So it's really a coordination and script filling mostly for Dan because he's so healthy. Well, the big issue for Daniel communicating any needs is his lack of speech. So while he has a lot of words, he doesn't communicate with words. He does use an iPad with a communication program, but that's more for asking for particular requests rather than communicating what he's feeling. So it's very difficult in a health sense to understand how he's feeling. It's really like working out what's wrong with an infant. So we really have to look at symptoms and causes rather than what he's indicating, which is basically nothing. Before a seizure, he can be a bit irritable for a few days, so behaviour can be a hint, but he can be irritable just because he's in a bad mood. And immediately before a seizure, he will go pale and goosebumpy and say, what's wrong? So at least we know that a seizure's about to happen. But apart from that, it's really very much a guessing game like it is with a baby. Well, I found that there were issues in 2 ways. One is that paediatricians tend to give you a lot more information and be a lot more interactive. And I found that the adult specialists seem to respond more to questions rather than just giving you a lot of information. The other issue for us was a behavioural issue in that Daniel doesn't like change. And it will take 1 to 2 years before he's really comfortable with any change. So just a simple thing like changing a doctor's room, changing who he's coming to see, will create a big issue. And as he gets older, if he tantrums and lays down on the footpath, well, you can't pick him up like a child and throw him over your shoulder and go into the doctor's room. You have to wait till that's passed. You can preempt some things by using perhaps a social story to say what's going to happen and pictures. That works well on some occasions. On other occasions, it will actually make him more anxious. So it's really sort of judging how he's feeling and how to play that. I think it's really important that the GPs do listen to the carers, whether that's a parent or a carer in supported living, because they have a much greater interaction with the client. They will be able to read the person with Fragile X and how they're feeling and what's happening for them in their lives. So really listening to the parent. I've certainly heard of cases where people have said the doctors thought the mother was overreacting because she was worried about her child. I certainly haven't had that experience, but it is very important to listen to those people who interact with the individual with Fragile X on a daily basis.